So welcome you all to the 6th National Conference, Atacon 2024. The theme is New Horizons in Ayurveda, which is endorsed by Maharashtra University of Health Science and NCISM and recognized by MCIM, Mumbai.
Hello, myself Dr. Rutesh Damle and my colleague Dr. Kiran Ube. I welcome you all and we are going to start with our first session. And speaker for the first session is Dr. Prasanna Kulkarni sir, and chairperson is Dr. Sanyogita Londe madam. Session coordinators for this session are Dr. Ankush Dikondwar and Anjana Ghogre madam. I invite them to carry forward this session. Thank you.
Thank you, sir. Thank you, ma'am. Suprabhatam Sarvebhya. Good morning to all Vaidyas, doctors, academicians, and dear students. A very warm welcome to 6th National Conference Atacon 2024, New Horizons in Ayurveda, endorsed and accredited by Maharashtra University of Health Sciences, Nashik, recognized by MCIM, Mumbai, a gathering of the finest minds in the field of Ayurveda. Myself, Dr. Ankush Dikondwar, and it's my honor to serve as a session coordinator for this morning's first session. Today we are here to discuss the New Horizons in Ayurveda, bringing together Vaidyas, doctors, academicians, clinicians, researchers, and practitioners from the various specialties to share their insight, experiences, and knowledge. We are privileged to have dearest and respected Dr. Prasanna Kulkarni sir as our speaker for the topic, Role of Artificial Intelligence in Ayurveda. I request, sir, please come on stage.
Good morning, all of sir. Dr. Prasanna Kulkarni sir, MD Ayurveda and MD Data Science. He is the HOD and professor of his teaching experience is total teaching experience 20 years. Currently working as a professor and HOD in Department of Swastha Vrutta Preventive Medicine, Sri Kal Bhairaveshwar Swami Ayurveda Medical College Hospital Research Center, Bangalore. He is worked as a professor and assistant professor SJG Ayurvedic Medical College, Khopoli for 13 years. He is worked as TMAE Ayurvedic Medical College, Hofstet for 2 years. Publication and his publication, Effect of Yoga and Physical Health in Overweight Individual with Special Reference to Body Composition of Analyzer, Phytochemical and Physiochemical Analysis of Nalamardi of International Journal of Ayurveda and Pharmacy, and in vitro antibacterial study, Nimbadi Arc, a non-alcohol based herbal and hand sanitizer, International Journal of Ayurveda and Pharmacy, Effect of Structured Physical Activity on Inflammation and Immunoactivation, Profile in International Antiretroviral Therapy, Experienced Children Living with HIV, Pre-Dieter Extensor, Importance of Katukadi Shruta Jala Pariksha in the Management of Vatrakta, International Journal of Applied, is a huge list of article publication.
Thank you, ma'am. Now I would like to request the chairperson of this session, Dr. Sanyogita Ramkishan Londe ma'am, to please come on stage. Along with this, I would like to request co-chairman of this session, Dr. Dnyaneshwar Khandare sir, Professor, Shalyatantra Department, KG Mittal Ayurveda College, Mumbai. Sir, please come on stage.
Welcome to Dr. Sanyogita Ramkrishna Londe ma'am. She is working HOD and professor of Kriya Sharir department. Kriya Sharir department of which college? Working as PIMS deemed university, Pravara Rural Ayurveda College, Loni. Sorry, ma'am. She is working experience as 10 years, 3 months. UG professor in deemed university, Loni, Ahmednagar. UG reader MUHS Nashik. UG reader Kurukshetra, Haryana. UG lecturer in MUHS Nashik, 5 years, 1 month. Is total experience 10 years. Then she is international seminars participated in Ayurveda Omni International Convention of Ayurveda Goa 23rd and 24th April of 2014. 7th World Ayurveda Congress Kolkata December 2016. Amrut Sangam International Ayurveda event. First International Ayurveda Conference Arogya Expo Nepal. National Seminars Update Ayurveda 2014 Technology Meets Tradition organized by Dr. Sharadini Dahanurkar Advanced Center Ayurveda Research Training TN Medical College of Nair Hospital Mumbai. National webinars she is attended so many. Here administrative experience is experienced college council member, academic committee member, coordinator, traditional curriculum member, member of exam branch institute level, member of seminar committee institute level. She is working as BOS member Ayurveda at Pravara Institute Medical College deemed university. Okay, thank you, ma'am.
As you all know, artificial intelligence is used by each and everyone in present era. So with this, I would like to request our respected speaker to share their insight. So please, hand over to you.
Good morning, respected chair, co-chair, dignitaries, students and my dear friends. Basically, I asked them the first question, how much time I have, because as a teacher, you know, when we stand on the stage, our mind is set for 60 minutes or so, right? So that's why I asked them. And if I exceed, please caution me that this is a conference, not your class. Fine. To begin with, the organizer have asked me to take a session on Ayurveda and AI. I slightly modified in that role of AI-driven digital platforms in enhancing Ayurveda learning and practice. These are the two components which I will be taking you all through. How best we can utilize the current trends of artificial intelligence to enhance our teaching experience along with clinical practice. So with this, let me start my session. As you all know that Ayurveda being ancient science, which is having its own traditional background, Guru Shishya Parampara, we all know that where the student right at the age of 12 years will be attached with the Guru and will be moving around with the Guru all the time, trying to understand the concepts with respect to his clinical expertise. That was the setup in those days. As the evolution passed, there was a drastic change in this Ayurveda education also, where we started 9 to 5 program, right? And at the same time, even the kids, right from their age of 3 years, started getting exposure to technologies, thanks to COVID. We all know, we all witnessed the COVID time where our children, our students were forcefully made to expose for technology-driven classes. So whether you like it or not, that is the need. The students, whosoever comes in our classroom, they already have a good exposure of technologies, various gadgets, and if we, at that point of time, restrict ourselves for traditional Ayurvedic approach, there may be some sort of hiccups. What is this? Already we are facing that issue. Till +2, they will be exposed with lot of scientific driven insights. They will believe what they have seen in the lab, like because they have done sufficient experiment. Whereas as soon as they enter into first year, we start teaching them about Vata Pitta Kapha, which we never show them on the table because we know the fact. That itself is a big challenge. Now over to that, the scientific gadgets, what they were using, if we were unable to showcase the significance of Ayurveda through them, then that will be very difficult for the younger generation to digest Ayurveda at the beginning stage itself. And hence, Ayurveda education should be taken to that level so that it becomes more interactive, more personalized, accessible, adapting to the contemporary needs while maintaining its rich heritage without compromising on any of the Ayurvedic principles. If we were able to translate the principles of Ayurveda into the contemporary technology, then I think that is going to be the ultimate award to our younger generation. Of course, the current state we all know, where we have a typical chalk and board kind of approach, thanks to NCISM, which have brought a very big shift by introducing a lot of NLH classes, at least for first and second professional students. The teachers of final years, I know they are not yet been experienced with that. Don't worry, in next 6 to 8 months, you will get a batch, you will get a syllabus copy where you will struggle a lot to initially to cope up with the new syllabus. First year and second year teachers, you know how much we are struggling to adjust ourselves for this newer syllabus to bring the best to our students. Yup, slowly we started changing in that regard. Of course, there are sufficient challenges in the current educational framework. What are the principles we can translate? What are the principles which we want to keep it in the classroom session itself? All those things are there which we need to address, and accordingly we need to execute. And at the same time, there is a big scope for innovation, newer technology that has to be merged with the flow, that is the Ayurvedic flow. Keeping that in mind, and by the way, let me tell you, except the QR codes, what are the images you will be seeing on my screen, they are all AI generated. No copyrighted business, no Shutterstock pirated images, they are all crafted on AI platform, which you can also do. Once when I go through the session, you will also come to know it's in your it's already there in your mobile. But only thing is, some of you may not be aware of that. I will let you know how best you can create these images and embed them in your regular classes or clinical practice whatsoever, wherever you want, you can apply the same without any charge. And the other QR code, what you are seeing, that is the QR code of, you can make a note of this QR code. This will, don't do that now. This will take you to my website, which is called atharvaayurtech.com, where as of now, I have launched 3 apps, applications, mobile applications. Of course, they are technology driven, not AI driven. eDravya, eRoga and eChikitsa. Let me show some light on that. eDravya is that tool where you can assess the drugs based on certain criteria. Like if I want Lagu Guna, Ruksha Guna, Shita Virya, Katu Vipaka, Tridosh Shamaka Dravya. If I give you this criteria and ask you to get me the drugs, probably you may not get back to me in at least 3 to 4 hours with textbooks in your hand. Thanks to that application, within fraction of seconds, you will be landing on a page with all these criteria. And if you click on various buttons on that, you will get pharmacognosy insights, which you will be taken with respect to CP Khare's illustrated medicinal plant information. Apart from that, there are some other websites like Impact, where you will come to know about the molecules present in the drug, and also PubMed link. Straight away you will be landing up in PubMed, where various research papers on the drug have been highlighted, keeping Ayurveda in core. Along with that, the image of the drug and other information like Vividha Bhashanam kind of insights you will get just based on single click. And for physicians who are inclined for Ekamulika Chikitsa, there is one option called action. Click on that. Say for example, Madhumeha. What if your patient is having Madhumeha and Jora? If you click these 2 options, you will get the set of drugs which are having these 2 as like Falashruti or indication to tackle both the condition. So in that way, you can use eDravya, which is on the learning platform. The other app being eRoga, it is like symptomology of Ayurveda. Like you can concise a condition based on several symptoms like Jora plus Pratishaya plus Kasa plus Shwasa. If you mix these 4 symptoms, you will get set of condition. Only Jwara, 235 condition, including Purrupa, Rupa, Arishta, Upadrava. With Shwasa, some around 165 condition, with Kasa, some conditions, and the dual combination, Jora plus Kasa, Jora plus Shwasa, Kasa plus Shwasa, Shwasa plus Pratishaya, triple combination, and all 4 in one set. Like that, you can get through that. And if you click on that specific disease, you will get all the symptoms as explained in various Ayurvedic classics with references. And of course, I have compiled around 6,660 shlokas with respect to the disease alone. You can search all those things on this e-Roga platform. The other one being e-Chikitsa, where like the e-Roga, you can select the appropriate medication for the specific condition. Say for example, if the patient is having Jora plus Kasa, if you select these 2 conditions, then you will get what are the common medicines that are being prescribed in these 2 conditions. Like the same, if your patient is not inclined towards Kada or Churan, what you can do, you can select the condition and there is a click box, you can select tablet, Vatigulika, Avalehas. So with respect to that formulation, you will get the medicine. So that's about these 3 applications which are also there on Google Play Store. You can explore them later. And apart from that, there are various online courses from EDX or Khan Academy with respect to Ayurveda or without non-Ayurvedic topics also you can find over there. Various AI tools already available on education platform. 1 year back, I sat with my daughter who was in 6th standard at that point of time. I got good comment on ChatGPT. I asked her, let me know if you are facing any difficulties with respect to your subject. Then she told, all these days you are not interested in teaching me, all of a sudden how come you are showing the interest? Then I told her, now I have a new tool where it will help me to understand your understanding level and I can simplify and explain you. Then she told, no thanks, I am already having an AI tool. My daughter at the age of 11 years told me that she is using AI tool. Right? And I have written the name of the tool called ZU AI. Okay, if you explore this, it will ask in which standard you are studying directly to the student rather than to the parent. What kind of system, education system they are into, CBSE, state, NCRT, they have to select. Then with respect to the subject, it will give you good number of quizzes, good number of understanding of the classes, topics with good animation, algorithms. It will help the kid to understand the concepts so super that they will not forget the thing. And of course, question paper. At the same time, at the back end, it will also score the performance of the kid. If the kid scores good, then it will be rewarded with some coins, which will help the kid to unblock various other domains in that app. Else, it has to be paid. That's how it has been designed by the crafter of that AI tool. So just imagine when our kids got already exposed to that and entering our first day of BMS, and if we don't have any tool, then how exactly they feel, right? So that struck my mind and I started exploring various things in Ayurveda. Of course, when we use this, there will be a paradigm shift. Various personalized AI tools should be made available for our students as well as for the teachers. There should be virtual classrooms, AI-enhanced learning atmosphere should be there, so that will make the subject very easy, very practical for them to understand. So when I was in BMS, till final year, I never visited ward. I never got exposed. Now, with respect to the current syllabus, curriculum, even with Samhita Siddhanta subject, teachers are taking the students to ward. That's the concept now. Means, bench to bed, already been started from first year itself. Now, when they are having that kind of exposure, we should make them to translate their theoretical understanding to practical application. Right? So, it's a high need of the time. You can come out with the simulation virtual labs like Yogya labs, what NCSM has recently come out with. Okay, we need to bring all those stuff. Of course, with AI addition to that, it is going to a very good eye-opener for the students right at first year itself. Or else, what they will think, already I have taken the system of medicine which is ancient, and my teachers are teaching me in the ancient methodology of using chalk and board. So, of course, I'm not comparing anything over here, but trying to meet the student expectation at that stage. Once when he cross second phase, then he will know the richness of Ayurveda. But till at that time, we should not make him heartbroken for choosing this system of medicine. AI-based adaptive learning paths tailored to individual needs. That's how I have started creating various AI tools, which I will showcase, because I don't want to just talk about the theory. I want to take you through the things, what and all I have crafted using ChatGPT as the platform. Because earlier, 1 year back, I started my journey using one platform called Aura. Till April, I have launched not less than 20 AI tools pertaining to Ayurveda and medical field. All of a sudden, on May 4th, that platform collapsed. All my 20 AI tools gone. So what I thought is, let me translate the same into the existing main hero of this AI era. So I translated everything into ChatGPT. Of course, there are some hurdles when you start using it, which I'll be showcasing. I'll be taking you with respect to around 4 to 6 such tools I will be taking you, because only talking about AI and Ayurveda will not solve the purpose. But showcasing how we can utilize will definitely make sense. That's what I strongly believe, and I will take you through this stuff. The first app which I'll be showing you is Sanglish. Sanglish, as you know, it's a mixture of Sanskrit and English, like Arukshka, Saifina, those kind of thing. So Sanglish is Sanskrit and English, where it helps the person to understand the meaning of the Sanskrit words. I will show you how exactly this platform works. And by the way, at the end of my presentation, I will be showcasing one QR code. Please make a note of that. You can access all these tools on that platform. Okay, no need to worry about searching those tools on chatbot, because you may be missing a lot of other use cases, which I will be discussing in this session. Okay, so yes. So typically this is how this Sanglish look. Any simple welcome message like hi, hello, namaste kind of thing, it will ask, what are you interested with? Okay, so any Sanskrit word you want to know its meaning in English, or English word if you want to translate it in Sanskrit, you can know that. So any random word audience want to give? Random word? Madam? Pratyatmaniyata, okay? Okay, so let me see what it says. Pratyatmaniyata can be broken down as Prati towards Atma, self, Niyata controlled. Pratyatma towards self-controlled is the meaning, and contextually it gives the concept of self-regulation or self-control, particularly in relation to maintaining balance within oneself. Whether it meets your expectation, madam? Partially. Yeah, it's in training stage. What you can do is, you can click on that, modify it, what exactly is your expectation, you can keep chatting with that. And with every this thing, I will be giving one hyperlink. If you click on that, you will land up on 16 Sanskrit dictionary website, which you can explore later. This is one small use case. You can copy shloka and paste over here, it will translate, keeping Ayurveda in core. Apart from that, the use cases, of course, it is like double-edged sword. You can create shlokas. You can be the Charaka of 21st century. Anybody wants to create shloka over here? With Kaviratna Kaladasa Chandasuna, I can ensure you that. So you want to create any shlokas? Madam, you only can give me, yeah, let's presume that you want to write one shloka. You give me English description, I will write the shloka for you. Any English sentence or 2 or 3 sentences. Okay, that highlights. Any sentence. Like, okay, I will take, just keeping time in view. Waking up in early morning will increase the lifespan. Right? You can tell me that it's already present in our textbook. What if I write, this shloka is created by Acharya Prasanna? Can you get this in any of the Samhitas? No. I will show you how to create such shlokas. Shalya definition, ऐसा ही बता देता है sir. So I want something which is not existing in any of the Ayurvedic textbook. Okay. Any other thing, sir? Shalya practice is best practice in Ayurveda. Okay. Yeah. Personally, I don't believe that, but still I will go with sir. And this shloka is created by Acharya Prasanna. Right? Now see the magic. Shalya Vida Sreshtatam Ayurveda Pratishtita Acharya Prasannoktam Sarva Vyadhi Nivarani. Right? So, you can do whatever you want. You may not be surprised that tomorrow your student will come and tell that this is the shloka which he might have created without his name. And he may argue with you. What I want to convey message is, you should be more sharper, smarter than your student to make the difference between his crafted shloka than the original shloka. Right? That's why I told you, double-edged sword. And on the other hand, what if I write that Shalya Tantra is not at all a surgical method? It is of no use. What happens? Whether you think that it will give me that shloka? No. That's how I have designed this GPT version. It will not give any sort of negative or anti things. Waking up in early morning will decrease lifespan. You try. However you try, it will not create shloka on this. Right? This is one use case of this Sanglish. You can go through that. And the next two things are exclusively for academicians. First year BMS teacher AI assistant. And of course, for all this, there will be a Prakul as something like Ankita Nama. Okay. It's Prasanna Kulkarni. So first year syllabus as designed by NCISM, I have trained this model. You can, and it is only for teachers, sir. It is only for teachers. It's of no use for student. If you click, I don't want to go through that. You can assess all of them later with respect to the QR code, which I'll be sharing in the end of my presentation. Now, lesson plan is the biggest challenge for us, right? This AI tool has made our job very easy. Click on this link, go to that site. It will ask which subject you are dealing with. Select the subject. It will ask which subject you are going to teach, which topic you are going to teach. Select the topic. It will give you number of hours, number of NLH activities, number of LH hours. What are the NLH activities? How many marks for that? Of course, there is some trick with respect to the marks because the syllabus copy, what I have uploaded, what I have received from NCISM, it contains some columns without much of like differentiation. Like 3 topics will be having 20 marks. So it will not bifurcate. It will give the 20 marks for that topic alone. So we should be careful enough in that. In which term it should be taught? What are the assessment parameters? What are the teaching methods? Everything in one click. Now, in one context, the syllabus may ask you to deal with quiz on the topic. Then ask, I want to conduct quiz on this topic. Help me out. It will give you very super duper description with respect to time factor. In 1 hour, 10 minutes introduction, 10 minutes forming the group, 40 minutes give the topic and ask them to discuss, 10 minutes conclude. Everything with a proper roadmap it will give. That's the beauty of these two applications. And the recent one, this is my recent one. It's called Ayurveda AI by Prakul. As a teachers, now we have to design games for our students, right? So what I thought is, what if the AI take that job? So the first 2 were for teachers. Something let me do it for students, my children. So I have developed this AI Krida. Of course, it is in training stage, but still I can take you through this, how exactly it looks and how exactly it works. Any simple hi message, it will ask you to select the subject. So, of course, I am developing this based on CBDC subjects, first and second proficiency subject. So, these are the subjects that are displayed. Forgive me for the Sanskrit not being added over here because Sanglish is an exclusively chat for that. Okay, which subject you want to explore? Any random subject? Dravyaguna, okay, fine. No need to write Dravyaguna, just write H. It will understand because it is AI, more smarter than us. Sorry. Good choice. So it will ask to select the difficulty level. 1 being the easiest, 10 being the difficult most. What do you want? I will go with 7. Right. So role-playing scenario. It will give you a scenario. You are an Ayurvedic practitioner. See, it is asking the student to stand in the shoes of practitioner. That's how I have crafted this. So that they feel more responsible to study the subject and learn them with more interest. And the patient comes to you with a chronic digestive issue. You suspect that the patient Agni is impaired. Which dravya you will consider to stimulate Agni and improve digestion? Select any one of them. So what I will do is I will go with the D, right? So randomly 2, there is something else. So here, just to keeping time in mind, I will say, 2C, 3D, 4A, 5D. Okay, randomly I have selected these options. Then it will tell what is my answer, what is the correct answer with explanation, whatever I have fed, I have trained. And of course with respect to some published information across the internet. Right? So question 2, question 3, question 4. Okay. So all these kind of things you will tell, and at the end it will give you the score, right? And some sort of explanation so that you can better understand the concept and study in well. Right? And I have kept a upper limit for that. You can't play more than 2 games in a day because I don't want my students to get addicted for this. Right? So that's about Ayurveda. Next, for practicing, yes, there is one foodie GPT. This, being a Bangalore practitioner, I don't know whether you come across such situations or not at Pune or Mumbai like metropolitan city. My patients are very curious, very anxious. They keep on calling me, doctor, my blood sugar was 115. After eating tomato, it became 135. Is tomato dangerous for diabetes? All these kind of questions they will be asking. Keeping that in mind, I have crafted this very simple tool, exclusively meant for patients. Just type whatever they want. It will give the ingredients, method of preparation, nutritional values, glycemic index, glycemic load, protein index, and also how many steps to be walked to burn those calories with Ayurvedic insights. What dosha shamana it will make. And if there is a thali, keep adding. 1 puri plus 1 chapati plus 1 cup rice plus 1 rasam, 1 cup curd, 1 pickle, 1 udad papad. It will calculate everything and it will throw the result in one table. And at the same time, how many steps to be walked to burn those calories. I can keep talking on this for hours together. I need to respect the time also. Another important recent development, what I have designed, of course, I'm not sharing this. It's still in development stage. Network pharmacology. This situation we come across a lot of times in our clinical practice. A patient of Amvata will come to us who is already on methotrexate or prednisolone. Whether our Guggulu, say Simona the Guggulu, is going to have any adverse effect or any synergistic action on Visolon, this question always have in our mind. Somehow with respect to our experience, we take risk and try to prescribe. Thanks to network pharmacology AI, it will help you to understand the synergetic effect of these molecules present in that drug. I have uploaded some of the PDF with all the classical preparation. If you just write the classical preparation like Sitofaladi Churna and you want to experiment on say Pratishaya or allergic rhinitis, it will first give the explanation about allergic rhinitis, what are the biomarkers, what are the molecules that got derangement in that, and after adding your molecules, it will tell you what are the chemical constituents present in those herbs, what are their mutual interactions, and it will ask one more question, whether your patient is on any concurrent medicine. If you write, yes, cetirizine. So in chronic rhinitis, what happens if a person takes Shitofaladi Churna with cetirizine? It will explain everything with reference. It will not talk in air. It will give all the reference that are made with to grab the bioactive principles. Of course, no paper might have been published with cetirizine and Shitofaladi Churna, at least for my knowledge. I have not seen such papers. If such papers are there, definitely it will take and it will give you the reference. Copy that reference, take it to PubMed or whatever the site, you will get the whole of the description of that paper, right? That's what this network pharmacology is about. Yes, there are certain challenges when we come across this AI. The challenge, what I am anticipating is Brahutrayi challenge. I have translated all this Charaka Shushruta Vagbata in soft copies. I have developed a Python code. Lack of time, I will be skipping that, or else I will show the Python code. If you give the word in that Python code, say for example, Prasanna. If I give that word Prasanna, it will give me the option, Prasanna. It will give the option, Prasanna, Prasanna, Prasanna. All this option it will give. I have to select one option. Based on that option, it will search across the 3 samhitas and give you the output with shlokas. Then you may ask me, already that has been done in the form of each Charak Samhita. Yes, that is super duper superior than my version. Only lack on is I have to go for individual one and I have to click on those individual hyperlink and understand the context. So here, by seeing the shloka itself, you will understand the context. Is that prasana something to do with swastha? Is that prasana something to do with asavarishta preparation? Or this prasana is something to do with dhatu pure form? So like that, it will help you by understanding the shloka itself. There finish the matter. When I try to translate the same on AI, there is a concept called hallucination. During my academics, when I was studying this data science master program, I heard about that, but now I am practically facing. When I ask my AI model on this Brahutrayi to search on specific word, 4 or 5 reference it has given. Later it started creating the shlokas on its own. Unnecessary things it will put. That is called as hallucination. The term what we use in medical practice. The same thing applies for AI also. Unnecessarily it hallucinate, it creates and gives false references. That is the biggest challenge I am facing. The reason being very simple. It is not much trained on ancient languages like Sanskrit. If I am able to cut this to make the GPT to understand, I am struggling since past 6 months to break this. If we are able to do that, then all our samhitas can be brought on AI model, AI platform. You can search whatever you want that are present in our samhitas only, right? And hence, that is the biggest challenge. Apart from that, there need to be some regulatory things to be there, some legal aspect to be there. What happens unnecessarily, students out of curiosity, they know unnecessary things and land up with lot of difficulties. There need to be a demarcation, what to be learned, what to not to be learned. So 1 year back, I was of the illusion that students should never get exposed to ChatGPT because they will be going a step ahead of the teachers. Now, after listening to some of the talks, I have changed my mindset. Whether you teach them or not, they are already in the domain. But teach them with the limitation so that they know what to use, what not to use, where to use, and what are the limitations, where it will not work, right? So future direction, this is what I'm imagining. Right from BMS first year, when the student enters the BMS college, there should be a virtual robot along with him. Whatever the student understand, that day, evening, he has to teach the same to that virtual robot. And when he come out of the college, either that virtual thing can be translated into robot, and when he sit in the clinic, it has to guide him with respect to the classes, what he have understood, how best he can give precise prescription, robots in Ayurvedic practice. This is what I'm dreaming. Of course, it may be an extreme dream, but let's think of the sky. We may reach the tree, right? So that's what my imagination or dream is. We need to build a lot of such AI tools for the better understanding of our students, for the betterment of our future, not only in teaching, but also in research and clinical practice of Ayurveda. Yeah, this is the QR code. You can take a pic of this. Whatever the AI tools I have discussed in front of you, just by clicking on this, you will be taken to AI corner on my website. You can take a pic of this QR code alone. The only problem is, yes sir, usko upar utana hai. Yeah, sure sir. Okay, of course, as these are all on ChatGPT 4 version, after 6 or 8 conversation, GPT, there will be high traffic and it will tell you have to come back after 2 or 3 hours or maybe 6 hours or maybe next day. It may ask for subscription. It is left to you whether to subscribe for 4 or not. It is your call. If you opt that, it may charge you around 2,300 rupees per month. It's your decision whether to go for that or not. Else, every day around 4 to 6 conversation, definitely you can do on this. After that, it will cease and it will tell when you can come back and you can keep continuing those things. I recollect one saying from Rigveda, Ano Badra Krutvayantu Vishwata, let the noble thoughts across the globe comes to us and we restart the innovation, change the direction of our understanding and help the mankind. With this, let me end my session. Thank you so much for your patience hearing. If you have any questions, is there any option for questions, sir?
If anyone has a question, they can ask at last of the session. Thank you so much, sir. Yeah, yes.
But they can do that, na?
Thank you so much, sir, for sharing your thoughts on such a innovative and unique topic. It was a really informative and innovative session. Thank you so much, sir. Now I would like to call our next speaker, respected Dr. Sachin Sarate, sir, on stage. Dr. Sachin Sarate, sir, please come on stage.
Welcome to Dr. Sachin Sarate, sir. He is working as assistant professor cum campus doctor in Department of Biomedical Engineering, Sri Subramanya Nadar College of Engineering SSN Trust Institute, Shiv Nadar University, Chennai. He is MTech Biomedical Engineering, IIT Bombay, MBBS Government College of Aurangabad. He is certificate in AI, data science and analysis, Meritonium Knowledge of Academy, Navi Mumbai, certificate in business intelligence, data visualization, online Meritorium Knowledge Academy, Navi Mumbai, certificate in healthcare management, August 2022 to November 2022. His subject and lab thoughts, human anatomy and physiology, pathology, microbiology and biomechanics, robotics in medicine, human assistant devices, whereby devices, professional ethics for engineers, hospital management, physiology and biochemistry laboratory, pathology and microbiology laboratory. He is senior research associate, Airoli, Navi Mumbai, concept generation for new medical devices, literature review pertaining to medical technology, solving design problems to medical device design, human resource management, making protocol models, research fellow in School of Bioscience in Bioengineering, IIT Bombay. He is first aid instructor, Central Railway Institute, Bhusawal, first aid training to drivers and guards to Central Railway. His clinical experience, general medical practice in proprietor of Udyam clinic location is Bombay. Volunteer medical doctor, emergency medical officer, junior resident doctor, medical officer, casualty medical officer is a number of publications.
Thanks for this opportunity to share my knowledge and experience here. So I'm Dr. Sachin Sarate from Thane now. Earlier I was working in Chennai. I recently quit the job and I'm having my own clinic at Thane now. So I did my MBBS from GMC Aurangabad and then I did MTech in Biomedical Engineering from IIT Bombay. I did some certification courses in data science also. So I'm here to just share something about data science that I have learned with you. So this will be the overview of my presentation. Some small introduction about what is actually AI and how we can use it in biomedical research and healthcare delivery. And some applications I will show in medical education. So how we can actually use this AI in medical education, in non-clinical as well as clinical subjects, and a small glimpse of my own research, my publication in this AI. So John McCarthy, he is the father of artificial intelligence, and artificial intelligence, as the word came in, so this was coined by him, and it is the science and engineering of making intelligent machines, especially intelligent computer programs. So intelligence, we say that humans are intelligent and the computer should be able to mimic human intelligence. That's the aim of this artificial intelligence. Now, what are the major differences between human and artificial intelligence? So artificial intelligence, it makes objective decisions, fast calculation abilities, able to mimic human conversations, low chances of errors in familiar problems, and able to conduct research and hunt facts within few seconds. So if it is given some database, it can scan through it very fast and it can give you certain output. Whereas for human beings, makes efficient decisions for ambiguous and uncertain cases. So something nobody has ever thought of, that also like a human being can think of and give solutions. Works better in novel situations, emotional and social intelligence is there. So in many movies they have shown this difference between human and non-human intelligence. Abstract thinking ability as well as the ability to look ahead to future. So these are major differences between AI and human intelligence, and definitely AI can never surpass human intelligence, as we very well know. Now a small what you can say, classification, gross classification of AI, weak AI and strong AI. So right now we are using this weak AI in our day-to-day life. Many people must be having iPhone, so they can use this Siri there, then Alexa is there. Nowadays almost every house is having these Alexa devices. IBM Watson was the first one which was device there in the US, and we know that there are many self-driven cars, autonomous vehicles, etc. nowadays. All of these use this weak AI, so also called narrow AI or artificial narrow intelligence. So it is AI trained and focused to perform specific tasks. And then comes this strong AI. Strong AI or artificial super intelligence, we have not yet reached there. And whatever we are scared of about artificial intelligence, where it will reach. So many movies like this, Terminator, we have seen, and apart from that, like then whether a human can surpass that or not. So then came this Matrix, where then that Neo, he had to choose between the red pill and the blue pill. So he chooses the red pill and he comes out of that Matrix. So for human beings, right time has come for us also to choose between AI or not. So AI as a tool to use to develop ourselves, definitely it is useful and we should know something about it. Now the food for this artificial intelligence, it is data. So I want to just make people understand or like make it comfortable, make everybody comfortable that it is not out of our reach. It is simply data of two types, qualitative and quantitative. So data is of two types, everybody knows. Now these people, they give this special name, categorical data and numerical data. So actually, whatever we learn about qualitative and quantitative data, that is one and the same. And then they are, again, differentiating into ordinal, nominal here for categorical, and discrete and continuous for numerical data. So what is nominal? So one type of qualitative data where like just this one truth about the data, that like color of hair or sex of the individual or color of eye. So that is a qualitative nominal data. Ordinal data here, nowadays for every shop you go to Decathlon or somewhere, you shop there and then they will tell from 0 to 10, like give us some rating. So this hot, hotter or hottest, like that, this is this ordinal data. Then discrete data where we need whole numbers and integers. So here there are whole numbers and integers, there are no fractions at all. And then comes the continuous data. So here we actually use fractions, we use rational numbers, and that is how we collect the data. And we know that this type of scenario, our CBC report, we have so many values there, and all this can be summarized. So AI helping in actual treatment. So when a patient comes with a huge file of his data, that whole data, if we can scan it and make some AI tool where the data can be gone through by that AI, and whatever relevant factors are there, that can be shown to the practitioner. That can really save a lot of time for the practitioner. So what are the sources of data in medical healthcare? Okay, so we have many records coming from medical imaging, inpatient health monitoring, examination of patients, whatever we actually do, palpation, percussion, etc. Then patient-generated health data. Nowadays, many people are having wearables where like continuous monitoring of heart rate, etc. is being done with smartwatches, etc. And many lab results keep on coming. People keep on doing this blood tests, pathology tests, etc. So all these records, they can be put into analysis. And what output we get from that? So depending on the complexity, the value of that analytics differs. So if you go into data science and you want to run your own company as a data scientist in future, so what happened, that is descriptive output that you get, diagnostic, why it happened, that output you can give to the client. Then predictive, what will happen. So some prediction from whatever data you are having, and then prescriptive too. So to change certain state in future, what needs to be done, that also can be brought out from the AI models that you develop. So a flow of data analytics project goes like this. You just ask questions, then prepare the data, process it, analyze it, then share data with your audience or your client, and then act on the data you have created. And machine learning, so there is supervised, unsupervised, and reinforcement learning. You can see all these different outputs that we can get. So from supervised learning, we can do image detection, customer retention, diagnostics, weather forecasting, market forecasting, or population growth prediction. So all these predictions can be done using supervised learning. From reinforcement learning, we can generate games, do robotic navigation. We can learn, so learning tasks. So reinforcement learning mostly goes into all that which is taking out jobs from people nowadays. Skill acquisition, real-time decisions can be taken by this reinforcement learning. And unsupervised learning, so here, these all customer segmentation, targeted marketing, all this, even our corporate hospitals, they are using nowadays this whole big data to target customers, means patients, and get proper output. Now, machine learning, deep learning, artificial intelligence, so you can see that these are the subsets. So deep learning is the subset of machine learning, and artificial intelligence, it carries both this machine learning and deep learning. So the theory and development of computer systems able to perform tasks normally requiring human intelligence, that is artificial intelligence. In that, machine learning. Now the ability to learn without being explicitly programmed, that is machine learning. So you need not write that program explicitly, and once you get one model, it keeps on working. Then deep learning, machine algorithms with brain-like logical structure of algorithms called artificial neural networks. So now here I have shown the difference. Deep learning, it can work on a huge amount of data and needs more computational power as compared to machine learning. Now I'm coming to use of AI in medical diagnosis and treatment. So some small applications. So you can see here a huge number of applications can be seen in various domains of healthcare, some of which are radiology. So you can give this data, and then from there, the radio diagnosis can be done easily using some AI models. Oncology, so huge amount of different types of data can be entered, right from imaging, multiple omics, so proteomics, genomics, all that data, blood and tissue data, from the records, the history of the patient, and all that can be put in, and the oncologist can make a proper decision about the patient. Cardiology here, again ECG is there, heart sounds are there, echocardiography, continuous ambulatory vitals of the patient coming from his wearable device, all that can be compiled together, and a cardiologist can take a proper decision about what medication should be given to this patient, whether he will need any intervention, whether there will be heart attack very soon or not. In forensic medicine, if we get a skull, earlier like they used to do this morphological mapping of the face using anthropometric data. Now that can be easily done by computers using AI models. Then in age determination also, same thing, we can use the, thank you. Now here one company is there, Cloud Physician, excuse me. This is the actual company running from Bangalore, where you can take a subscription. So you run a hospital somewhere far away from Bangalore. You have ICU, but you do not have intensivists in your hospital. What you do, you take a subscription from Cloud Physician. These people will come and fix a camera in your ICU like that. And from that camera, they will see all the vitals of the patients from all these monitors and continuously monitor the patient. And these people will be sitting there in Bangalore and analyzing the data there. And from there, they will be giving orders. So 24/7, there will be intensivists sitting there and giving treatment to the patients all over. So we can compile this whole data in different ways and use it in a management of a hospital. Now some small demos on AI in medical education. So how this augmented reality works. You must have heard about augmented reality, augmentation of whatever reality you are having. So for example, now we are sitting inside this auditorium here. Whatever we see with our eyes, everything is real. And inside this, if we add up something on top of whatever surfaces we see, so that will be augmenting this reality. So a camera can be taken which will map the surfaces, and depending on that, some new objects will be created. So we have seen while shopping in Amazon or while shopping in this Lenskart, where they create artificial goggles on your face, etc. So I'll be showing you a demonstration of a app used for teaching anatomy. So this is a virtual body app. Okay, so now this is like a 3D model that is made. Now how we can use a augmented reality. Now you can see all these dots here inside this actually mapping the surface. So we have an actual real model standing in front of us. You can see that there is nothing here. So this guy is actually standing here in front of us in this auditorium, and I can go inside his body. So this is the nucleus pulposus you can see in the vertebra, and we can add systems. So I have added a heart now here, and you can see the posterior aspect of the heart, the anterior aspect. Everything is getting generated here. And even you can enter the heart and actually see the wall. So which wall is this? Can you see the three cusps? So that is the tricuspid wall. So here is our pulmonary artery, the aorta, the bicuspid wall. And apart from that, there are microanatomy. So now this middle ear and internal ear, we try to learn it so many times, and visualizing all these things is so difficult. But when we have such tools in a hand, how those three ear ossicles, they work, the cochlear nerve, the vestibulocochlear nerve, even these two muscles. So this tensor tympani muscle is there, and stapedius. So these are actual muscles there inside our ear, which help us to become what? During the classroom hours, we can actually voluntarily become deaf. So many times we see that our students, they are not listening to us. They are using those two muscles to ignore us in the classroom. So a very nice tool here to learn. Now, another real tool. So this VeinSeek Pro, I'm using it to actually draw blood from the patient's veins. So this app, it is an iPhone app, and again it works on the same principle of augmented reality. Now, so I'll just show you such. So you can see, if you see his veins right now like this, you will see that you can see nothing here, whereas we use the app, and you can map it in real time. So this is how we can map the veins in real time and stop. Fine. I think that was the only demo left now. So there are some small videos I would like to show, which show where artificial intelligence is taking this medical health. Audio cable? Audio cable nahi hai kya? Okay, you can see that audio cable chahiye tha. Audio cable. Okay. हाँ वो माइक स्पीकर यूज़ करता हूँ हाँ I need net for this. Company which is developing these holographic visualizations and that are coming right now to the operation theater.
Medivis advances surgical care with augmented reality, artificial intelligence, and computer vision. The Surgical AR platform is an FDA-cleared medical software device to visualize patient imaging data in 3D world space. It uses the Microsoft HoloLens 2, low-latency networks, and a mobile workstation. This is a breakthrough for clinicians and patients across medical centers, allowing for improved safety and efficiency in operating rooms, the ICU, and the clinic. The first major advancement is our photorealistic rendering capability, which simulates the physics of light with...
So when I was working as an intern, in 2001 I finished my MBBS, and I was working as an intern in Grand Medical College, JJ Hospital. So we had these boxes of that tube light box, typical where we see that X-ray, and all that CT scan images and MRI images, they will fit there. And like we are doing surgery on the patient, and we are referring there on that box outside. So now they have brought that whole thing into a real 3D image, which you can superimpose directly on the patient on the operating table.
Accuracy using AI algorithms. Our renderings at interactive level frame rates reveal unprecedented detail in medical imaging in any specialty and any part of the body to create a holographic digital twin of your patient. Here's a deeper look at the user interface in world space. The user experience is smooth and effortless. We develop advanced computer vision algorithms for positional tracking of instruments in 3D space with sub-millimeter accuracy. These instruments can be used to holographically register medical imaging to the patient for informational purposes.
Now here is, from the image, he is registering the 2 points near the eyes, and from here that he will now put the same points on the patient who is there in the operating room, and then he can see directly on the patient that CT.
Never before has it been possible to contextually understand the patient's imaging at the point of care. The fidelity of the registration is unlike anything you have seen before. Numerous additional tools and features provide valuable clinical insights while improving operator confidence and removing uncertainty. Enterprise PACS integration
So at
allows
what depth the
professionals
tumor
in
is there,
neurosurgery, ENT,
plan the surgery,
orthopedics, radiology, and plastic surgery, among other interventional departments, to integrate augmented reality into real clinical workflows. Over time, we believe this technology will become a standard in surgical care. Unlike anything you've seen before, come open the door to the future with Medivis and see the unseen.
So this was an example of using these images to plan the surgeries. Now, what if we can train the surgeon before the surgeon starts doing the surgery using haptics? Haptics means like you have your phone and that vibration works in the phone. So same way like these haptics where you can actually touch and feel the pressure. So they have developed these tools. I will show a small surgery. It's a 1.5 minute video. How they can train the surgeons. So this is a spine surgery where this pedicle screw is to be put inside the spine.
In the virtual OR.
And this is a completely virtual operating room.
In the virtual operating room, I can see there's a number of different elements. There's a tool selection box. There's instructions. There are various different machines and pieces of equipment.
So the two things that he is holding in his hand, those are the haptic tools with which he will interact with the virtual reality there.
Around the room, and there's an X-ray. And here in front of me is the patient, all ready for surgery. I'm using the rongeur tool to start with, and that's haptically enabled, so I can feel each of the vertebrae on the spine and the soft tissue around also. First, I'm going to take a small piece of bone from there and confirm that I'm ready. Next, I enlarge the hole I've just made with the rongeur using the awl. There, that's nice and enlarged. So what I'm also able to do during the procedure is to use the X-ray to check I'm in the right position. And here you can see on the X-ray that I'm going into T3 nicely in both transverse and sagittal planes. The key part of the instructions is to teach people how to make the actual probe into the channel work, to give them the correct angle and then to measure it. So let's try that. Using the calibration on the probe, I'm able to go into the correct depth and at the required angle. Let's X-ray and see how I've done. Now I have a feeler, so I can check the integrity of the channel and see how well or otherwise I've done. And that's complete. We can now use the screwdriver to put in place the pedicle
You can
screw.
feel that screwdriver, and
At any point, I can take an X-ray to see how well I'm doing. And yes, there is the screw.
then now this was a pure demonstration of how we can feel the cutting and the tissue, etc. Now, what if we take this to next level again in this operating room, where we can generate scenarios where the patient can go into complications? So again, same way, haptic tools are there. There is an anesthetist, and there are surgeons all working together. This is a mannequin only. So they are operating on the gallbladder, everything virtual. You can see the tools, endoscopy tools. Now suddenly there is an emergency on the table. They're using the defib. So before the surgeons, actually the anesthetists go and operate on real patients, like what we are right now we are practicing, that like they start with scratch on actual humans. So if such type of training comes to all colleges, it will be a great boon. And this is a small contribution from my side to medical AI in medical application. So there is one data set called Wisconsin data set, which is a set of FNAC images. So there are many images there in that data set, and they have been already divided into some features. Around 32 features are there. And you know the procedure for FNAC, we put a needle, we apply suction, we take out the tissue and we put it on a slide, and then we see under microscope. And from this, now, we don't see a single medical word there. And this is how the AI scientists, they look at the data, the image. Now these are the different features of the nuclei of all those cells that are seen. The radius, the texture, the perimeter, area, smoothness, compactness, concavity, concave point, symmetry, etc. So all these different types of 32, so 32 columns are there. First column is the ID number. Second column is diagnosis, whether it is malignant or benign. And then the remaining columns are all this information, which is completely a mathematical number. And based on that, so we did some, we ran some models, and we found that certain models work better and certain models do not work good on this data set. And the work is still going on. We keep developing newer and newer models, and we keep trying on that. So it's purely theoretical work, and such models can really be brought into medical practice, and that can help oncologists as well as pathologists, as well as radiologists, etc. So to conclude my presentation, so AI helps in improving accuracy for more correct diagnosis and more effective treatments. It is instrumental in early detection of ailments like cancer to save patients who are at risk of developing serious conditions. It aids in forensic diagnosis also. Please plays key role in dissemination of medical education, as we saw some examples. And it is effective tool in healthcare management and policy making for the government. So these were some references that I used. Thank you for your patient listening.
Thank you so much, sir. If anyone has any doubts or questions, now they can ask. It's a question and answer session now. Mike.
Check.
Are there any side effects of the instruments you use on the patients?
Side effects of?
The technology or the instrument you use for the radiation, or to know the depth of the tissue or whatever the organ you are sensing?
You are asking about my research?
Yes. No. You have told that when the surgeons are operating in the operating room and you are scanning the patient, during scanning, are there any side effects for the surgeon or any allied staff?
Yeah, definitely there. C-arm is an integral part of modern operation theatre nowadays. C-arm is there in all operation theatres. C-arm X-ray machine. So definitely that radiation issue is there. We need to properly protect ourselves with those proper, that lead coat, etc. So that is a part of, that has nothing to do with AI as such. That is a routine that is followed.
Okay, yes. Thank you.
So there was a small thing I tried yesterday regarding Ayurveda. So what sir was discussing was about all that natural language processing part of AI, your chat GPT, etc. So generative AI, you give some order and then it creates some output. So I hope everybody here has a chat GPT. So I went to chat GPT and I straight away gave that, write an essay on Charak Samhita. And this is what it generated. That Sutrasthan, I don't know ABC of this. I'm totally, so all this I could generate directly from up to conclusion. Then I saw another word there, explain Nidan Sthan of Charak Samhita. Very nicely it created this. All you must have read or learned these things. And then I thought let us try that whether it really works or not. So I straight away explain the first sloka of Sutrasthanam of Charak Samhita. All it extracted from the internet and it has described, translating each and every word. You can see here. So same way you can pick up any word. So make a PPT slide show on what I can you give a word? Simple. when upashaya, upashaya, upashaya. See what it is doing. This is real time happening right now. So it is giving me suggestions. What should be there in first slide, second slide, third slide, fourth slide. Practical applications, limitations, and conclusion. So these are the very small uses of. So we are all against this AI for this purpose, where students can really copy these things and use. So we have to be we have to be aware. So before the students submit their submission, we should also go and check there. Thank you very much.
You have illustrated very well. It is a very great boon for the science and technology. I would like to know what inspired you to go from medical to technology or science. You jumped from MBBS to MTech. What was that thing which inspired you?
Yeah, surely, sir. When I saw all the practices that were, so I did my MBBS in Government Medical College, Aurangabad. I was quite a good, sincere student. After second year, usually our theory subjects are there, and along with that we go for clinics. So the way the medicine was being practiced in the wards, in the clinics, etc. So I thought that there is a lot of scope for developing tools for doctors. So some issues were happening in the operation theater. So when you are there in the OT, you see these things happening. So many things we ignore, or many things do not come out of the ward or come out of the operation theater, what actually happens there. So I thought I have that aptitude to develop some tools which will be helpful in future for the doctors. So I worked there for 13 years in a engineering college. I tried developing tools there, etc. And then because of some family reason, I had to come back to Maharashtra. Now I am trying to develop my own team, and there are some people from Pune also who are helping me. Let us hope I can really contribute with some tools to medical science. Thank you, sir.
Elaborative lecture delivered by sir. Once again, thank you so much, sir. Now, I would like to request chairman of the co-chairman of this session, Dr. Khandare sir, for concluding remark.
Good morning, everyone, my dear gurus and my dear friends. This is a very excellent session. Two speakers in this session, Dr. Prasanna Kulkarni sir and Sachin Sarate sir. This lecture is very fantastic and very fruitful to us. AI is new to us in BMS or in our Ayurvedic peoples. तो थोड़ा मैं हिंदी में बोलूँगा मेरी भाषा में. तो सर ने बहुत ही अच्छा लेक्चर दिया है. एआई जो है बहुत ही यूज़फुल है हमारे लाइफ में. मैं भी थोड़ा स्टडी कर रहा हूँ एआई का. तो यहाँ पर क्या होता है, घंटों का काम मिनटों में हो जाता है. जो हम 10-10 दिन लगाते हैं पढ़ने के लिए, वो विदिन 5 मिनट्स या विदिन 2 मिनट्स हम पढ़ पाते हैं. और जो हम पीपीटी बनाते हैं, ऐसे ऐसे एआई के टूल्स है जो भी मैंने देखा है, मैंने पढ़ा है. तो उससे जो है हम पीपीटी जो है हमको बनाने के लिए 1-2 दिन 8 दिन किसी को लग जाता है, लेकिन उसके सहायता से जो है हम विदिन 2 मिनट्स में पीपीटी बना सकते हैं. चैट जीपीटी है और दूसरे भी बहुत सारे टूल्स है जो मैं यूज़ करता हूँ. और हमारे पीपीटी जो है, हमारे पीपीटी बोर न होकर बहुत से सुंदर पीपीटी बन सकते हैं. एआई का हमने थोड़ा सा ज्ञान लिया तो बहुत ही सुंदर सर का लेक्चर हुआ है. इट्स वेरी फ्रूटफुल, वेरी नॉलेजेबल एंड वेरी फैंटास्टिक. आई एम सो थैंकफुल टू ऑर्गेनाइजर डॉक्टर सूर्यवंशी सर, डॉक्टर एंड ऑल द मेंबर्स इन आवर ATA team. I am so thank you so much for giving me this unique opportunity.
I would like to call respected Dr. Sayugita Ramkishan Londe ma'am for concluding remark in brief.
Thank you, sir. Good morning, all. Frankly, I must say this. When I started to listen first lecture of this first session, I just feel I am listening Sant Gnaneshwara. All Maharashtrian people knows who is Sant Gnaneshwara and what he did for common man. Sant Gnaneshwara was translated Bhagavad Gita to Marathi Gnaneshwari, Sanskrit to Marathi, to understand the sar of Bhagavad Gita. Actually, thank you, Dr. Prasanna sir, to giving me vibe of Sant Gnaneshwara. Thank you, Atacon committee and ATA to give me the privilege to be a chairperson of such thoughtful and practical session. Thank you, Dr. Prasanna Kulkarni. He has given great contribution to Ayurveda field by working on AI in Ayurveda. As we all aware of diversity in our Ayurveda science on basis of Koshtha, Prakriti and Agni, we need to plan the dose as well as selection of medicine. AI in Ayurveda help us to individualize method of breakdown in patient by improving efficacy of Ayurveda treatment. और एक चीज़ बोलना चाहूँगी कि फर्स्ट ईयर की फैकल्टी होने की वजह से मुझे पता है, उसके साथ साथ मैंने थोड़ा सा नॉर्थ में भी काम किया था, उस वजह से ये भी पता है कि फर्स्ट ईयर स्टूडेंट्स को संस्कृत पढ़ना कितना डिफ़िकल्ट लगता है. उस वजह से मैं आपको बहुत बहुत धन्यवाद देना चाहती हूँ कि किसी ने तो इनिशिएटिव लिया है. मे भी हो सकते हैं काफ़ी लोग, मगर मुझे चांस मिला उनको सामने बैठ के सुनने का, तो मुझे बहुत अच्छा लगा. और ये चीज़ जो है आपका जो टूल सैंग्लिश वो बहुत बढ़िया है. एक्चुअली कैसा है कि आज हम जब देखते हैं कि पेपर प्रेजेंटेशन करना है तो उस टाइम पे खुद का कुछ होना चाहिए. तो यहाँ पे उन्होंने जो बोला था कि इंग्लिश में कुछ सेंटेंस दो और उसको ट्रांसलेट किया जाता है श्लोका में, वो चीज़ बहुत बढ़िया है. मतलब आजकल का ज़माना है 2 मिनट्स रेडी टू इट, सब चीज़ें रेडी चाहिए फटाफट. और स्टूडेंट्स को भी अगर किसी फर्स्ट ईयर स्टूडेंट को कोई प्रोजेक्ट दिया जाता है तो बच्चे तो करते क्या है कि जाते हैं इंटरनेट से आयुर्वेदा ढूंढते हैं. तो ये चीज़ आपने जो की हुई है तो उससे एटलीस्ट आजकल के स्टूडेंट्स को कुछ जो बृहत रही या फिर हमारे जो टेक्स्ट है आयुर्वेदा टेक्स्ट, उनसे जो बेसिक और इम्पॉर्टेंट चीज़ें वो मिल सकती है. तो थैंक यू अगेन और थैंक यू डॉक्टर सराटे. आपका जो भी है मेनली आयुर्वेदा के बारे में मैंने इसलिए बोला क्योंकि स्टूडेंट्स को आयुर्वेदा भी पता होना चाहिए. मॉडर्न से तो पहला प्यार है हमारे स्टूडेंट का, वो बात ही नहीं है. मगर थैंक यू टू ऑल, थैंक यू.
Thank you so much, ma'am. Now I would like to request Dr. S.K. Das sir, ATA President Goa, HOD and Professor of Dravigun Department, to felicitate our respected speaker Dr. Prasanna Kulkarni sir with memento as a token of love. Please give a big round of applause. Thank you, sir. I would like to call Dr. Ravi Srivastav, sir, ATA President, Madhya Pradesh, for the felicitation of respected speaker Dr. Sachin Sarate, sir, with a memento. Dr. Ravi Srivastav, sir. Thank you, sir. Now I would like to call Dr. Sachin Chandalia, sir, BOS member, MHS Nasik, for the felicitation of chair and co-chair persons. Thank you so much, sir.
I also request Chandalia sir to felicitate today's session coordinators, Dr. Ankush Dikonwar sir, Assistant Professor, Rog Nidan Department, Datta Mega Ayurvedic College. And also Dr. Anjana Gogre Madam, Assistant Professor, Department of Rog Nidan, Sumati Baisha Ayurved Mahavidyalay.
It's time to wind up the session with a vote of thanks, and for that I would like to call Dr. Anjana ma'am.
Hello. Now it's time to wind up this session by the vote of thanks. I would like to extend my deepest gratitude towards our respected speaker, Dr. Prasanna Kulkarni sir and Dr. Sachin Sarate sir for sharing their experiences and knowledge on such a unique topic of role of AI in practices. We would like to the thanks of chairperson for this session, Dr. Sanyugita Ramkrishna Londe ma'am, and co-chairperson Dr. Gnaneshwar Khandare sir for sharing their valuable golden time and for remarks. For thank you so much sir and ma'am by concluding this session's remark, and thank you all once again. Thank you.
Was of course a very informative session.